Hi, everyone. Thanks so much for joining us. My name is Alex Abramovich, and I go by he and him pronouns. I'm a scientist at the Institute for Mental Health Policy Research at the Center for Addiction and Mental Health in Toronto, and an assistant professor at the University of Toronto. My program of research investigates the health and social inequities experienced by 2SLGBTQ individuals, with a focus on understanding the experiences and needs among 2SLGBTQ young people experiencing homelessness in Canada. My presentation today is going to focus on providing background information on 2SLGBTQ youth homelessness and the need for targeted responses, including population-based housing programs such as YMCA SPROTT House and Blue Doors Inclusion Program. In recent years, all levels of government have shown an increased level of interest regarding 2SLGBTQ health across Canada as a result of years of community advocacy, activism, and research. And just like any population, the experiences, needs, and challenges vary widely among 2SLGBTQ populations, depending on a variety of variables, including age, race and ethnicity, gender identity, sexual orientation, and numerous other variables. 2SLGBTQ individuals face unique challenges accessing safe and inclusive housing options and are disproportionately represented among those experiencing homelessness across Canada, with up to 40% of the homeless youth population identifying as 2SLGBTQ. 2SLGBTQ youth tend to experience homelessness at younger ages and for longer episodes compared to heterosexual and cisgender young people, leading to more issues in the long run and making it more difficult to safely and successfully exit homelessness. Identity-based family conflict resulting from a young person coming out as 2SLGBTQ is the most frequently cited reason that queer and trans youth experience homelessness. Additional factors include exiting public systems such as child welfare and the juvenile justice system into homelessness, unstable and insufficient employment, and poverty and racism. Some 2SLGBTQ individuals are more likely to experience homelessness and poverty compared to others. For example, racialized queer and trans individuals experience homelessness at disproportionate rates. Hidden homelessness is also a significant issue among 2SLGBTQ individuals, especially for those who are living in rural and remote communities, making it difficult for them to be included in key statistics and reports on homelessness. And this is an issue that is often conceptualized as a big city problem, which it most certainly is not, because 2SLGBTQ individuals exist everywhere in rural and urban communities across the country. These numbers that I'm sharing with you today, they might be higher or lower in some communities across Canada. We still don't know because we haven't been collecting the data up until fairly recently. And even when we do collect inclusive data, many people are missed because they don't access services due to safety concerns. The majority of homelessness counts and literature on homelessness have typically categorized lesbian, gay, bisexual, transgender, queer, and two-spirit individuals into one category, making it very difficult for us to differentiate between gender minority and sexual minority populations. One of the biggest issues that 2SLGBTQ youth face in shelters and housing programs are issues regarding safety. 2SLGBTQ youth are often unsafe, especially youth who navigate systems with multiple marginalized identities and are subjected to racism, transphobia, and homophobia. 2SLGBTQ youth report that they're regularly forced to choose between unsafe situations due to a lack of safe and affirming housing programs. And they often end up choosing the option which will allow them to be their true authentic selves, even if that ends up being the least safe option. And that really emphasizes the importance of 2SLGBTQ inclusive and safe housing options. Homelessness, discrimination, and social stigma have serious consequences on the health and well-being of 2SLGBTQ people, leading to significant mental health issues, including anxiety, depression, and suicide, and increased alcohol and substance use, especially among trans and non-binary people. I recently led a study focused on 2SLGBTQ youth homelessness in York Region, which is a regional municipality just north of Toronto. We focused on York Region because there's limited research on suburban and rural youth homelessness in Canada, even though we know that there are unique challenges and barriers associated with youth homelessness in smaller towns and in rural settings. Rural and suburban communities tend to have fewer specialized services and resources available to youth experiencing homelessness. Support services also tend to be less accessible to youth in these communities since they're often centralized in larger cities. For this particular study, approximately 42 individuals participated. It was a mixed method study, and participants completed standardized surveys that assessed their mental health outcomes and in-depth one-on-one interviews. Mental health was a major concern for the majority of youth who reported experiencing emotional, psychological, and mental health difficulties. For example, 65% of youth scored in the severe anxiety range, and 61% reported that they had been diagnosed with depression. The vast majority of youth expressed issues regarding feeling lonely, fearful, nervous, and being worried about the future. And this was a study that was conducted prior to the COVID pandemic. I'm currently leading a larger study focused on the impacts of COVID-19 on 2SLGBTQ youth experiencing homelessness in the Greater Toronto area and surrounding areas. And we're seeing major impacts on mental health throughout the pandemic. Consistent with findings from previous research, self-harm and suicidality was really an ongoing issue for the majority of participants in the York Region study. 74% of youth reported that they had self-harmed without the intention of suicide over the past year, and more than 1 in 3 had attempted suicide. I think it's really important to note that 2SLGBTQ young people who come from families that reject them are 8 times more likely to attempt suicide than those who receive familial support. Supportive families and safe and supportive environments are critical to the health and well-being of 2SLGBTQ young people. Unfortunately, not all 2SLGBTQ youth receive support from their families of origin, and the consequences of family rejection can have a lasting negative impact, which is one of the many reasons why 2SLGBTQ population-based programs are so important. And I'd really like to stress here that the key message is that the poor health conditions, particularly the poor mental health, is not because a person identifies as 2SLGBTQ. It is actually a direct result of stigma, discrimination, and violence, which create multiple barriers that result in poor health among 2SLGBTQ people. Being unable to secure safe and affirming places to live and formal employment and support, being subjected to discrimination and violence, which for so many is a daily occurrence, leads to poor health overall. And that is actually the key take-home message here. Many of the systems that we have in place that are meant to support all young people are often not constructed for or trained appropriately to meet the needs of 2SLGBTQ youth, especially trans youth, who have experienced multiple stigmas and multiple forms of discrimination. It has only been in recent years that the first housing programs specifically geared towards 2SLGBTQ youth have opened their doors in Canada. A major milestone was the opening of YMCA's SPROTT House in February 2016, Canada's first 2SLGBTQ transitional housing program. After many years of research and advocacy, the City of Toronto agreed to allocate funds to open YMCA SPROTT House, a 25-bed housing program that provides 2SLGBTQ youth with a safe and affirming and inclusive place to live. And like many transitional housing programs, they offer a wide variety of programs that are meant to support youth in a number of ways. But I would say that a major difference between SPROTT House and many of the other programs is that all of their programs have been designed through an LGBTQ2S lens, with the needs of queer and trans youth at the center of all aspects of their program. During the first year of SPROTT House's operation, I conducted a process evaluation of the program. All of the youth were invited to participate in one-on-one interviews as they moved into SPROTT House, and then they completed numerous standardized scales that assessed a variety of mental health variables, as well as self-esteem, family connection, employment status, and education enrollment. And that same group of youth were interviewed approximately 1 year later or earlier, depending on when they moved out of the program. And they completed a second survey assessing the same variables. All of the staff, including full-time, part-time, overnight staff, and management, were also interviewed about their experiences and their perspectives of working at SPROTT House. So the majority of youth who took part in the study described SPROTT House as an incredibly important program, and some described it as a community. Others described it as a family. For example, one young person said, "There's a community in the house. It's almost like a family. We stick up for each other. It's like I moved out of my mom's house into a better home with family that understand me, with people that don't disrespect me or make me feel horrible for the person I am." Youth spoke about a sense of belonging and acceptance that they had never felt before. And they described SPROTT House as the first space that they were able to just be themselves without having to fear for their safety. Youth's perception of safety in their daily lives had increased throughout their time at SPROTT House. Many of the younger residents viewed their older peers and staff as role models. Youth spoke about the need to see themselves reflected in the programs that they access, and they appreciated being able to connect with staff at SPROTT House based on shared lived experiences. Staff reflected on their experiences or their previous experiences working at other housing programs which were not population-based, and they described feeling appreciative of the safe and affirming space that SPROTT House had created for youth. Youth reported that the safe space created at SPROTT House helped normalize diverse gender and sexual identities, resulting in them feeling safe to explore their own identities. We also found that youth experienced decreased unemployment, with 85% of youth reporting that they were unemployed when they moved into SPROTT House, whereas 69% were unemployed when they moved out. Similarly, school enrollment increased, with 39% of youth reporting that they were enrolled in school when they moved in, compared to 56% being enrolled in school upon moving out. Numerous youth reported an improved sense of well-being and mental health while living at SPROTT House. However, some youth reported that their mental health needs were not being met. In many cases, this was because they didn't have a family physician due to previous negative experiences, which really highlighted the need for more intensive mental health supports to be offered at the program. The opening of SPROTT House has really been a very important step in the right direction, and it has actually inspired more programs to open and other programs to rethink how they deliver their services and whether or not they are actually 2SLGBTQ inclusive. For example, you will be hearing from Blue Door's inclusion program shortly, York Region's first specialized housing program for 2SLGBTQ youth, who I've had the pleasure of collaborating with over the past few years. And I will also be evaluating their new program in the near future. There are a variety of solutions to these issues that I've been talking about today, which unfortunately I don't have the time to go over. But something that I often speak about is the need for a standardized model of care in creating accepting, affirming, and supportive environments, because it allows people to know what to expect when they access services, which really could be an issue for 2SLGBTQ folks, especially if safety and inclusion depends on who is working on any given day. Many of the steps involved in creating a more standardized model of care are actually really quite simple, and they involve things like asking all clients and respecting their chosen name, gender identity, and pronouns on key institutional forms. What's key is that people see themselves reflected in the response options rather than forcing people into categories that don't represent who they are, as well as paying close consideration to the physical environment of services. So, for example, making sure that services are equipped with all gender washrooms and 2SLGBTQ inclusive and affirming resources. Mandatory 2SLGBTQ inclusion training for all staff is also key to ensuring that staff and services operate from a similar and inclusive framework. People need to see themselves reflected in the services they access. That is really what it boils down to. If we are going to appropriately respond to youth homelessness in Canada, we need to engage in a multi-layer response and develop strategies and targeted responses that reflect the unique needs of the diverse populations of young people who are experiencing homelessness across the country. But we need to make sure that communities and young people are involved in the development of strategies and services that are meant to support them. Oftentimes, when it comes to issues experienced by 2SLGBTQ populations, people wait until something tragic has happened before responding. So the response always ends up being reactionary, rather than thinking about prevention and thinking about ways to avoid tragedies from occurring in the first place. By making a commitment to prioritize 2SLGBTQ populations, housing programs and support services can create inclusive environments where people can bring their full, authentic selves. Thank you.